Hello, my name is Jacqueline Davis. I'm the General Manager with the Origins Project in Western Australia, and I'm also a PhD candidate. I'm presenting to the NOVA Annual Conference about evaluating perinatal women's engagement in digital wellbeing interventions in a birth cohort. Maternal mental health conditions during pregnancy and the postnatal period affect approximately 20% of women, with negative outcomes for women, children, and families. So investment in effective and engaging prevention and early intervention tools is critical. Digital interventions are cost-effective and accessible tools to support positive mental health. Although studies report efficacy, a key concern regarding digital mental health interventions, DMHIs, is the lack of engagement that can lead to dropout, lack of participation, or reduced benefits. The aim of our study was to explore the uptake of DMHIs in pregnancy and application of intervention strategies approximately 1 year post-participation. Data were drawn from a pilot randomised controlled trial comparing DMHIs based on different contemplative practices, specifically mindfulness, loving kindness, and compassion. We undertook a mixed methods triangulation approach. We looked at demographic data and psychological distress measures in the intervention groups and a comparison group that were offered the intervention but did not participate. Intervention participants undertook an 8-week intervention during pregnancy. They were invited to attend interviews post-intervention. We gathered both quantitative and qualitative data. The cohort comparison group consisted of over 500 individuals. The intervention group consisted of 54 participants, 26 of whom undertook the mindfulness intervention and 28 undertook the loving kindness and compassion intervention. Baseline psychological distress results showed a significant difference between those who enrolled in the intervention compared to those who did not, with higher psychological distress scores and stress subscores. For our qualitative data, we undertook content analysis, which identified 4 main themes from participants. The first theme was motivations to use skills. That is, connection and interaction with the child, increased self-awareness, breathing and relaxation. From participant A, and as I started to calm down, she felt that and she started to calm down as well, and then she falls asleep in my arms, and it was so good. The second thing was taking time for oneself. This included ensuring that the practice is a habit through regular reminders, but some participants simply felt they were too busy. Participant B: I think for me it was learning to take time out. No matter how busy your day gets, you sometimes need to just stop and pause and take a break. Theme 3 was emotional support. In particular, participants identified the need for a postnatal program. They wanted support network in person and virtual. They suffered with isolation and acute loneliness sometimes. Some participants actually thought there was no need for a training program. Participant C: so someone has to listen to you, someone has to listen to your problems. Sometimes this is all that you need. Theme 4 was improving well-being. The program aided sleep. It addressed some of their anxiety and depression feelings. Participants also talked about the negative impacts of COVID and the actual emotional impact of a baby. Participant D: I think just having a baby is just so overwhelming generally. In summary, the information collected in this study indicated that women who enroll in DMHIs in pregnancy have greater psychological distress than those who do not participate. DMHIs should therefore be appropriately targeted to those that need it in particular. Many participants continued to apply learnt skills and were receptive to DMHIs postnatally. So in summary, DMHI strategies may be effective and applicable longer term to enable women to apply positive coping skills in everyday life during critical child developmental periods. I'd like to acknowledge the participants in the Origins project and all those who participated specifically in this study. I'd also like to acknowledge my PhD supervisors, Professor Susan Prescott, Associate Professor Geneva O'Han and Dr. Amy Finlay-Jones. Please contact me at this website address or email if you would like more information. Thank you for listening to my presentation.